How's it going, guys? It is 2:29 a.m., 11th of June. Here in Japan, we have a pass level question for cardio for step one. Before we get started, please subscribe to the channel. I really appreciate it. Give it a like, really appreciate it. Find me on Instagram, mehlman_medical, mehlman_medical. Links down below. From your Telegram, links to the Telegram group channel down below. Now start the clip. 9-year-old boy evaluated for ventricular systolic overload. ECG shows left axis deviation and a left bundle branch block. Autoimmune and malignancy screening are negative, which the following is most likely explanation for this patient's condition. So let's just hop to the answer choice here. Choice A, coarctation of the aorta, correct answer. So the reason this is the correct answer is because, and I've harped on this in my other cardio clips here on the YouTube, if you go through the playlist, as well as in my cardio PDF. You simply need to know that left axis deviation on ECG means left ventricular hypertrophy, and that left bundle branch block almost always means left ventricular hypertrophy. That's literally it. So for example, you get a long fucking question, 15 lines, no idea what's going on. They tell you somewhere in the question that there's right axis deviation. It means right ventricular hypertrophy. Right bundle branch block, right ventricular hypertrophy. So both of these findings here, just simply left axis deviation, left bundle branch block, OMG, left ventricular hypertrophy. And we look at the answer choices. Choice A, coarctation of the aorta, is the only one that could cause left ventricular hypertrophy. Okay? Pretty much with a greater than 99% likelihood, because I decided to be hyper explicit and throw in the sentence of autoimmune malignancy screening are negative because lupus, for example, and malignancies can cause Liebman sac endocarditis, aka non-bacterial thrombotic endocarditis, aka morantic endocarditis, which are small verrucous lesions on both sides of usually the mitral valve. Okay? For example, the same fucking way rheumatic fever, rheumatic heart disease, tangentially tends to affect the mitral valve, rarely the aortic valve. It's similar with Liebman sacs. Almost always the mitral valve. So, sure, some students might say, Mike, couldn't it affect the aortic valve? No, not really. Okay, but I threw this in here anyway. Kid doesn't have pediatric lupus. There's no malignancy that could lead to Liebman sac. Okay, so left atrial dilatation, I mean, that's not an explanation for left axis deviation. I just said the left axis deviation and L triple B, they mean specifically on USMLE, for all intents and purposes, left ventricular hypertrophy. That's it. And so coarctation of the aorta doesn't have to be Turner syndrome. Okay, I mean, it doesn't have to be. They don't have to say that there's higher blood pressure in the arms compared to the legs, or that the arms have brisker pulses compared to the legs, that the arms are warmer compared to the legs that are cool and clammy. They don't have to explicitly say that. This question is nearly identical to one on one of the nbme exams. Okay, so left atrial dilatation, although this could occur secondary to left ventricular hypertrophy, if you have a left ventricular pathology, sure, over time, that could lead to increased afterload or preload, depending on the etiology, but that could back up to the left atrium. But this in and of itself is not causing our left axis deviation, left bundle branch block. Mitral stenosis, wrong fucking answer, because this would not affect the left ventricle. Okay, this would just be afterload on the left atrium. Okay, left atrial dilatation would be opening snap almost always. I've seen a question where they said there was no opening snap on a 2CK form, but opening snap with a mid to late decrescendo rumbling diastolic murmur. 99% of mitral stenosis due to history of rheumatic heart disease. History, okay, acutely, obviously it can cause mitral regurg, rheumatic heart disease, but later when the valve scars over, 5-10 years plus later, that will be mitral stenosis. And also mitral stenosis is the answer in second trimester of pregnancy when plasma volume has expanded 50% and the pregnant woman has dyspnea. Okay, obviously if it's around parturition and you have 4-chamber dilatation, in contrast, you want to think about peripartum cardiomyopathy, which is an antibody-mediated process. Wrong fucking answer. Choice Z, right ventricular hypertrophy, wrong fucking answer, because as I just said, no relation to these ECG findings or left bundle branch block. Right ventricular hypertrophy, question would tell you that there's right axis deviation, that there's a right bundle branch block. Obviously, etiologies for such a finding could be manifold. It could be left heart failure backing up all the way to the right heart, causing right heart failure. Right ventricular hypertrophy. It could be cor pulmonale, okay? Pulmonic valvular stenosis, things that could cause right ventricular hypertrophy. Wrong fucking answer. You know the deal. To make more content. If you like my stuff, subscribe my channel. Appreciate your time. That's it.